Hello everyone and welcome to another episode of IOHR TV. What does it mean to live without a nationality? During the outbreak of a pandemic, the Institute on Statelessness and Inclusion has recently looked into it and has released a report analyzing the humanitarian impact of COVID-19 on vulnerable communities around the world. ISI has also joined 83 civil society actors calling on states, donors and other stakeholders to promote and protect the rights of 50 million stateless persons worldwide who are now directly affected by the virus. Amal De Chickera, co-director of the Institute on Statelessness and Inclusion, thank you for being with us today. This joint statement and the report you have just released come during a pandemic that has shaken the whole world, but there hasn't been enough discussion about the impact that this has had on stateless people. What does it mean to live without a nationality during such a pandemic?
So we all know, for example, the messaging around social distancing and life in lockdown, staying 2 meters apart and wearing protective gear such as masks and gloves when we go out. Now imagine if you were asked to adhere to these kinds of guidelines in order to protect yourself and to protect others, but you lived as a refugee in the Kutupalong camp in Bangladesh, as a Rohingya refugee, where it's simply impossible to social distance. Or you lived as part of the Kenyan Nubian community in Kenya, or as the Urdu-speaking community again in Bangladesh. So stateless communities often live in conditions and situations where it is impossible to engage in social distancing. It is impossible to actually protect yourselves from either receiving the virus or protect other people from getting the virus from you if you have it, if there is an outbreak. Now imagine that these same communities, if they do get the virus, that they would be the lowest priority of states in terms of ensuring that they have access to healthcare. Now you add on to that the vulnerability of these people who are stateless and in this kind of condition, often also working in the informal labor sector, where as a result of COVID-19, they no more have a source of income. But because they work in the informal labor market, they also do not benefit from any kind of state relief. There's discrimination in terms of information not being provided to communities in the language that they understand. There's discrimination in terms of when people who look a certain way try to access healthcare, they are turned away from hospitals. We've seen this in Bangladesh, for example, where the Urdu-speaking community who live in camps in large urban slums, because there has been a documented outbreak of COVID-19 in these slums in Dhaka, when members of this community try and access hospitals, either for COVID-19 related care or even for other healthcare needs, including in one instance that we know where a pregnant woman needed to access a hospital to give birth to her child. They are being turned away.
Before getting to the singular aspect on the impact of COVID-19 on stateless people, can you please tell me how many people are stateless worldwide?
Unfortunately, the answer isn't necessarily straightforward or satisfactory. If you look at the UN figures on statelessness, you would find that there are close to 4 million people who are documented and verified as being stateless. But then you would also find UN language which stipulates that there are up to 10 million people potentially who are stateless. However, when the UN does count the stateless, it doesn't count refugees and it doesn't count stateless Palestinians within these numbers. And this is purely for methodological reasons. And what we at ISI do is we look at this 10 million figure, which is quite a conservative estimate, and then we add to that the known population of stateless Palestinians and the known population of stateless refugees, and then we're talking of a figure north of 15 million.
The state responses you have recorded during this pandemic exacerbate the harsh living conditions of stateless and undocumented people worldwide, but they also have a terrible impact on stateless rates, don't they?
For various reasons, the manner in which states are responding to COVID-19 can also heighten future statelessness cases. One example is that civil registries are in many countries not being deemed as essential services. And this means that it's more likely that births and other important events are not being recorded and not being registered.
Vulnerable communities have been excluded from state relief efforts. These people often have precarious jobs and are undocumented workers. How do you think that the lack of relief efforts targeting stateless and undocumented people will impact on poverty rates across the world?
The world wasn't equal when COVID-19 happened. The world was already very unequal, with a large number of people living in poverty. They're facing life-threatening situations, extreme poverty, starvation, being kicked out of their homes because they can't pay their rent and their bills, losing basic amenities.
Being ill during pandemic, if you are stateless or undocumented, can also mean that you can be arrested, detained, or harassed. Tell me more about it.
We've seen two very interesting developments as a result of the COVID-19 pandemic. One is that there has been much stronger advocacy and very successful advocacy in many countries to push for immigration authorities and detention authorities to release detainees in the context of COVID-19. But we are also seeing the opposite happening, where you have states going out and rounding up migrants, including stateless people, including refugees and asylum seekers, as well as irregular migrants, and detaining them. And where we saw this happen en masse with hundreds of people being detained was in Malaysia. You had the Ministry of Health Affairs, which actually announced very publicly that regardless of what your immigration status is, regardless of what your legal status is, you have the right to access healthcare. And this was seen by many as a very welcome and a very sensible thing to do from a public health perspective. But after the Ministry of Health announced this, the Ministry of Defense started raiding communities where there were large concentrations of migrants and detaining them.
Why shouldn't states choose immigration detention as a practice during this pandemic?
Immigration detention has to serve a legitimate purpose. And the legitimate purpose of detaining someone is to remove them from the country. And the argument is, as a result of the pandemic, you're not going to be able to remove anyone from your countries because no one is accepting people from abroad at the moment. Therefore, if you can no longer realize that objective of removing people, you have no right to detain them. Now, what's interesting about this is exactly the argument that we have been making about the detention of stateless people for many years. Stateless people cannot be removed, so you're not serving any objective by detaining them. Therefore, you have no right to detain them. So one potentially positive outcome of what's happened in the immigration detention regime is that we would see more states recognizing that if you cannot remove someone, that person should never be detained to begin with, and that means more stateless people will not be detained.
What is the role of the WHO and health ministries in addressing equal and safe access to medical care?
The message to the WHO and to other healthcare providers is do your background research and learn and understand about the way in which discrimination plays out in different societies. Whatever the issue may be, there will always be in any society, there will be people who are discriminated against and excluded for no reason other than who they are and what they look like and what some of their life choices may be. And this message needs to be taken very seriously by the WHO and by other actors. And they need to ensure that any provision of healthcare, and this will be even more important when it comes down to a future rollout of vaccines, that it is provided equally to everyone, and that it is not in any shape or form undermined and influenced by the structural discrimination that people face. This requires them to have difficult conversations with governments and to ensure that governments commit to providing equal health care for all.
What are the current obligations of states which must shape the way they respond to COVID-19, and what needs to be done urgently to ensure that no one is left behind?
It's very important for all those involved in a COVID-19 response to take a step back and recognize that we all operate within international and national and regional frameworks which set up the parameters and provide structures and obligations and guidance for us to kind of draw on in how we respond. This may be the international human rights law framework. It may be the sustainable development goals and what they say about achieving development for all and leaving no one behind. It may be the basic principles of humanitarianism, including the principle to do no harm and the principle of reaching those who need humanitarian assistance the most. Whatever it may be, these frameworks exist, but they also exist precisely for this kind of a challenge that is global, that is unique. And what the pandemic has shown us is that human beings need to work across borders in partnership and in collaboration with each other in order to understand and grapple with and address the big challenges we're facing. And if the scientific community can do that successfully, then why can't the political community, why can't the economic community do so as well?
Amal De Chickera, thank you.
Thank you very much. It's been a pleasure.
And thank you for being with us for another episode of IOHR TV. From myself, Margherita Kargasaki. Until next time, goodbye.